As a health provider, you play a key role in working with us to help people recover from their injuries. Ensuring we have the right diagnosis is an important part of this. When we can accept cover on a claim, it is only for the specific accident and injuries identified on the ACC 45 at claim lodgement. We use the diagnosis to tell us about the level of injury and what that person's treatment or rehab needs are likely to be. As the legislation only allows us to fund the treatment and support for injuries that have been accepted for cover, it's important that you let us know when a diagnosis changes, or if it's incorrect in any way, so that we can update cover. Making sure we cover the right diagnosis means that your patient can get the right support from us, from you, and from other health providers. There are a few reasons why a diagnosis may need to be updated. Sometimes when an accident event causes multiple injuries, all the diagnoses may not be added at the beginning, or injuries may become apparent over time. For example, where there have been multiple severe injuries that needed urgent treatment following a vehicle accident, other more minor injuries may not have been identified at the time, and cover may need to be added for them later. An update or change of diagnosis often occurs when additional clinical information becomes available. For example, after imaging, assessment by a specialist, or from seeing a different type of health provider. There are also times when the read code chosen at lodgement was used in error or was not the most accurate description. Depending on what kind of a provider you are and how you work digitally or online with us, there are a few different ways you can update a diagnosis. Primary health providers can use the change of diagnosis form in your PMS or include it in an ACC 18 medical certificate. Medical specialists should use the consultation notes you are required to send us. For allied health providers, you can use the ACC 32 form, which may also be available in your PMS or via our online service. If you're working in an ICP MSK service, then you'll usually complete this as part of the triage process. If you're uncertain, then get in touch with Provider Help, our client's cover assessor, or a recovery team member. In many cases, the supporting information you need to provide to update a diagnosis is straightforward. For example, if you need to update a sprain to a fracture after an X-ray, we'll just need the images and your updated diagnosis. In more complex situations, for example, where there may also be non-injury factors or a delayed diagnosis, then it's helpful for you to give us as much information as you can about how the new diagnosis relates to the accident event or events. When we have all the information and can establish causation, which is the link between the accident and an injury, it's simple for us to add or update the diagnosis. When we're uncertain if the diagnosis can be covered, then we may need to ask for more information from you and other providers before we can decide. If we can't provide cover for the updated diagnosis, we'll let your patient know that we have not been able to accept the diagnosis and what the next steps are.